This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, everyone. This is Heiko Lada from the Acupunture On Air show in Hawke's Bay. And thanks everyone for listening, and we're having our third series of a show that we're doing with Dr. Jeff Shearer from Australia, from Newcastle, just north of Sydney. And today we're going to be talking in a quite a specialised topic, and I think it'll be interesting for a number of the listeners because it's a condition that is actually a lot more common than what we think, and it's called plantar fasciitis. So hello Jeff, how are you?
Good, thanks, Heiko. Glad to be back. Thanks for having me, buddy.
Yeah. Now, I'm just going to rave on a little bit about plantar fasciitis, but I'm going to bring it up because one of the other DJs at the radio station here, Ken Morrison, he pointed out that, did you know that there's only 3 words in the English language that have a double I in it, like fasciitis? And then, so your exam question is, Jeff, what are the other 2 words?
I'll get back to you on that.
Yeah. Well, I just let you know it's skiing and Hawaii.
Oh,
so you learn something every day. You've been to all these seminars, but a simple thing like that you just don't know. So,
mate, I'll take that one to my grave.
Okay. So and I have to say, like, I mean, I'm very biased in saying that the acupuncture is just the best treatment for plantar fasciitis. I mean, I know there's other conditions like with, I don't know, back pain and shoulder problem where all these other therapies, manipulative therapies, Pilates, whatever, they all have merit and they all can get results. But when it comes to plantar fasciitis, for me, acupuncture is just the thing that works. So anyway, I'm just going for what my patients have told me. But first, Jeff, tell us about this condition and how does it actually come about?
Yeah, okay.
And what is it for the people who don't know what it is?
So fasciitis is an inflammation of the fascia. So the way that I look at it is, when you look at the body, you've got the bones, which are essentially the scaffolding.
Yep.
You've got the muscles that move it all around, and the fascia is like the bags that the muscle sits within. And so there's a fluid that sits within inside that fascia and allows the smooth movement of the body without restriction. What happens with plantar fasciitis is that fascia starts to become inflamed for whatever reason, and as a result of that, it becomes incredibly painful through that area. And obviously with plantar fasciitis, it's the sole of the foot, and so you might find the whole foot is incredibly sore, incredibly sore to walk on. Even lying in bed at night, it can ache, it can feel burning, throbbing, and quite often it's a very difficult condition for a lot of modalities to be able to treat, because we walk on our feet all day, every day, don't we?
Yeah.
And so the ability to be able to stay off them and allow that inflammation to reduce is going to be significantly reduced.
And I think one of the keynote symptoms for it is that patients will say it's always usually worse in the morning,
Yep.
or worse if they've been sitting at their desk for half an hour and then they go to get up. And have you got any ideas as to why that would be?
So the reason that is, so any symptom that occurs that you find is like worse in the morning, it always tells us that tension is the problem.
Right.
So what happens with the body is all the muscles at any one point in time will be contracting slightly. Even in a resting state, they will be contracting a little bit. So when we're moving around, we're still stretching those muscles out. What happens when we're sitting for a long period of time, or if we're lying down for a long period of time, like if we're sleeping for, say, 8 hours, then those muscles are still contracting, but because we're not moving around, we're not stretching, and so they become much tighter. So any condition that shows up through lack of movement, it's always tension related.
Okay, yeah. Now, I mean, obviously there's so many different acupuncture treatment styles, protocols, and things that how you can address it. And I know my treatment for it has certainly changed over the years. But why don't you just give us a little bit of a rundown of how you might apply treatment, just for one example, for this condition.
So first of all, we need to recognise that it's going to take a bit of time to change that inflammation. So acupuncture, as we talked about, I think in the previous issue, is very effective at reducing inflammation in the body quickly. But what we need to also do is we need to make sure that we're able to release the tension as well. So it's not just the treatment, it's also making sure that people have homework to go home with, in which they can do some additional sort of stretching, and also some light, very, very light pressure point techniques that you'll use on the foot. But certainly for me, one of the classic things is the hands treats the foot.
Yep.
As you know, in Dung style acupuncture, and so generally we will use the palm of the hand. There's 3 points that I always use. If the plantar fasciitis is on the right hand side, I will use the palm on the left hand side. And then on the right-hand side, I will use some points on the top of the hand, so the back.
Now, what about for these patients and sort of home self-care type treatments? I mean, you've mentioned that you try to do exercises, but is there anything else that you can help these patients with?
Well, certainly, again, if it's a really chronic situation where someone's had it for, 5-10 years, and I have had people come in where they're talking those sorts of numbers, I will go back to herbs for additional anti-inflammatory approach, and also look at the diet, because again, I think we talked about previously, the digestion is the birthplace of the immune system. The immune system is where inflammation comes from, and so if the digestion is not functioning as we'd like it to, we know that inflammation is going to magnify significantly.
Now, when you say with the Chinese herbs, are you saying that there'll be herbs to drink or in a pill form or whatever? Is that what you're...
Yeah, look, there is certainly raw herbs, which you can boil up. I generally don't use raw herbs because I find most people...
Not compliant.
Well, it's just another layer of things you have to do to boil them for 20 minutes and not overboil them and then come back. And so I generally tend to use powdered formulas.
Yeah, same as me now.
And I will mix those formulas specific for the person. So I've got a lot of single herbs. I've got a lot of formulas. And so in the case of something like plantar fasciitis, I might put 3 formulas together for someone to try and help with that. And obviously specific for them. So we'll be looking at the pulse. I don't just have a plantar fasciitis formula. I will make that formula specific for the person, specifically for what's going on for them.
Now, you're probably a bit like me. You've had a reasonable amount of experience in treating this, and like with me. But what about, have you noticed any certain age group, or is it more common in females or men? Have you had any connections like that?
Look, certainly, Heiko, I tend to find it's more prominent in older folks.
Yep.
So 50s plus, and I do tend to find it's more prominent in women.
Yeah. Yeah. So I think I'm pretty well that, and a few others that I get, for want of a better word, is high-profile athletes, because they've made themselves old by just overtraining. So, and then they tend to...
I'll be honest with you, Heiko, as well. I've treated a lot of athletes over the years, and a lot of them don't really stretch appropriately for the level of training that they're doing.
Yeah, because it's like, I think I get that too, and I think whereas what they're focused on the training. They just want to get better at running, or better at swinging the golf club or whatever. So it's like, I've only got an hour to train, so I'll do 55 minutes of that and 5 minutes of warm up, and then they come and see us with injuries. So look, it's been really good talking with you, Jeff. So much appreciated that you've taken the time out of your clinic for this, and look, I'm really looking forward to some of these techniques when you're down in Christchurch next year. So that'll be a real eye opener for all of us over here.
March 9 and 10, I'm really looking forward to catching up with you then, mate.
And of course, we want some tips for plantar fasciitis too. No secrets
Of
left
course.
out, you know.
Of course.
All right, great. We'll see you next year. So goodbye, everyone, and we'll see you soon.
Thanks, Iko. Take care.
Okay, see you, Jeff.
This program was produced by and first broadcast on Radio Hawke's Bay, a community access media station. Thank you to New Zealand On Air for making this type of programming possible.